Hi, my name is Mike. 5 years ago I had surgery performed by Dr. Charles Ruotolo on a torn bicep tendon. I'm an electrician. The injury happened when I was holding a piece of pipe while somebody else cut it. As he cut through it, the pipe snapped. The weight of the pipe went down, snapped my arm down, and in fact tore my bicep tendon at my elbow. I was in a ton of pain, and that's when I knew I needed to see an orthopedic surgeon. I saw Dr. Ruotolo that day. He did a thorough examination on me, explained to me that I did in fact have a torn bicep tendon, scheduled an MRI for me immediately, and then went over the surgery that I needed to repair this. The surgery went very well. I was back to work within 8 weeks and doing heavy lifting again in 4 months. I work very hard in my profession, 6 days a week, a lot of lifting. I haven't had any issues with the surgery in my elbow since that day, and everything's fine, and I wouldn't even know I had the surgery.
Distal biceps tendon tear are significant in that 45% of your elbow flexion strength is lost once that's torn, and these are surgical problems because of that, because you need that to restore your strength. The surgery for this is time sensitive, as this is something you do like to do in the first several weeks, as the longer you wait, the more contraction that you get from your muscle, which can be more difficult to bring your biceps tendon down. It is different than the proximal biceps tendon tear, where certainly those could be treated conservatively if they're torn. The distal biceps tendon tear need to be repaired. As far as the repair goes for distal biceps tendon tear, we now do a newer technique where we make one incision in the front of your elbow through about a 3 centimeter incision, and we do a newer technique where we bring the biceps tendon down and reattach it to the radius where it's torn from, using a small titanium button that holds it in place. This is an outpatient procedure. It takes about 35-40 minutes to perform. Afterwards, the patients are on a brace for about 4 weeks. They can take the brace off the day after for showering, and they take the brace off several times a day for range of motion for their elbow. Starting at 8 weeks, they're out of the brace after 4 weeks, but starting at 8 weeks, they start doing some strengthening exercises. Most of this can be done at home because it's just simple flexion curls that you're doing with weight, and they progress with that until about 4 months. Most patients by 4 months are lifting about 25 pounds of weight for their curls, and then from there, for some patients, that is only a small fraction what they're going to lift, and they'll continue to progress with their strengthening. And for a lot of patients, 25 pounds is about all they need, and you're back doing most things by 4 months.